novel vaccine,
the Travis. Virus, and virus is basically a RNA virus, and virus is encoded by the 5 structural proteins, that is the G protein, N protein, P protein, M protein, and RNA. G protein is the major antigen in the formation of neutralizing antibodies against rabies virus. If you see the epidemiological aspect of the rabies, globally there are 59,000 rabies deaths per year globally. As far as India is concerned, about 20,000 rabies deaths occur per year in India, and 91% of the deaths occur in rural areas. This is the epidemiological aspect of the rabies. So rabies is 100% fatal disease, but it is 100% vaccine preventable disease. In India, dog bite are responsible for 97% of the rabies cases. In India, cats and monkeys have been known to spread the disease too, though this is rare. In India, the WHO reports on rabies is that about 60% of the deaths occur in Asia and 35% globally. Rabies deaths were not eventually distributed throughout the country. 1/3 of all the rabies deaths were found in Uttar Pradesh, and nearly 3/4 were in 7 central and southeastern states. So, no rabies deaths were reported in study area from following states: the Kerala, Jammu Kashmir, Jharkhand, Manipur, Meghalaya, Nagaland, Sikkim, Mizoram, Andaman Nicobar, Lakshadweep, Chandigarh, Daman and Diu, Dadra and Nagar. Altogether, these states represent approximately 7% of India's population. So rabies is 100% fatal, but 100% vaccine preventable disease. As far as the evolution of the rabies vaccine is concerned, the development of rabies vaccine coincided through 4 chronological stages. Those are neural tissue vaccines. Second one is non-neural tissue vaccines. Third one is cell culture based vaccine. And fourth, that is the latest recombinant DNA and protein based vaccine. In 1985, the first live attenuated vaccine the evolution of rabies vaccine. In 1985, the Pasteur first developed the live attenuated rabies vaccines. However, this vaccine had various adverse effects, such as neurological disorders and sometimes death. The members of the first generation rabies vaccines include the Pasteur vaccines, the Hogge's vaccines, the Pasteurelli vaccine, suckling mouse brain vaccines, suckling rat brain vaccines, suckling rabbit brain vaccines. These are all live attenuated vaccines. These vaccines promote autoimmune reactions in the recipient. Due to these reasons, the second generation non-neural vaccines were developed, where embryonated eggs were used for culturing the virus. The fourth generation rabies vaccine were developed based on recombinant DNA technology, where either the DNA vaccines or the protein summit vaccines were developed. The rabies virus consists of 5 genes, that is nucleoprotein N, phosphoprotein P, matrix protein M, glycoprotein G, and the viral RNA polymerase, that is L. Among these proteins, The G and N protein are known to be important for immunogenicity against rabies virus. Many approaches are explored since DNA recombinant technology become available to express the immunogenic recombinant rabies vaccine glycoprotein. Unfortunately, in humans, DNA vaccines were found to be poorly immunogenic. So what are the current challenges? Current rabies vaccines are cell cultured vaccines. They are inactivated vaccines, are more than 50 years old technology. They are inconsistency in potency, stability, short supply, and because of many adverse effects. And there is a decreased compliance because of multiple doses. So non-compliance is a major issue because of multiple doses schedule. So traditional rabies vaccines typically require multiple doses. The WHO recommending a 5-dose regimen administered over 28 days, 0, 3, 7, 14 in 28 days. However, the poor compliance with the 4th and 5th doses of the recommended 5 dose of rabies vaccine causes significant challenges to the effective prevention and control of this deadly disease. Various factors contribute to low compliance rate of the 4th and 5th doses of the 5-dose post-exposure prophylaxis regimen. Lack of awareness about the importance of completing the full course of vaccination, limited access to healthcare facilities, financial constraints, and inadequate follow-up mechanism of all contribute to suboptimal compliance. Additionally, fear of needles, discomfort associated with vaccine administration, and misconception about the side effect may also discourage individuals from completing the full vaccination regimen. Poor compliance increases the risk of insufficient protection against rabies, leaving individual vulnerable to the infection if exposed to virus. So, meeting the unmet medical need, introducing a novel vaccine with simple and shorter regimen, that is Travis. The Travis is first proteins subunit vaccine. It is prepared by the VLP platform technology. It is first vaccine with 3 doses intramuscular regimen 037. It is better compliance due to easy to flow regimen and less visits, and it is very convenient, ready to use, no need of reconstruction. So all these factors contribute to the better efficacy with good tolerability of the newer vaccine, that is Travis. The Travis is a world first 3-dose intramuscular regimen 037 rabies vaccines. The Travis vaccine is subunit vaccine. It is prepared by the virus-like particle, that is VLP platform, where nanoparticles can be engineered to elicit differentiated immune responses, which can increase the vaccine efficacy. The Travis is available as ready-to-use vaccine, no reconstitution required before administration. Currently, 5-dose regimen administered on 0, 3, 7, 14, 28 days are recommended for the post-exposure prophylaxis vaccination. Compliance remain a major challenges with 5-dose schedule in the post-exposure prophylaxis of rabies. Non-compliance rate increases as the dose duration increases, and it is reported as high as 40% in 5 doses non-compliance rate. So the Travis vaccine may help to improve the compliance towards full course of immunization due to unique advantage like reduced dose schedule, that is 0, 3, 7 days, resulting in less number of injection and reduced number of visits. So recent The recent advancement in the vaccine development will lead to availability of newer, more cost-effective vaccines that require fewer doses. In a breakthrough achievement, Cadila Pharmaceuticals has developed a novel 3-dose recombinant nanoparticle-based rabies G vaccine. The Travis is prepared by using VLP technology. The vaccine 50 microgram has to be administered through the intramuscular route on 0.3. The original research article was published in Association of Prevention and Control of Rabies in India Journal regarding development of a novel recombinant rabies G protein vaccine by VLP technology. To evaluate immunogenicity and safety of rabies G protein vaccine administered as a certain clinical trials was done with the newer novel vaccine, that is Travis, to demonstrate the non-inferiority of the test vaccine to the comparative vaccine. The primary objective was subject with seroprotection at 14 days post first dose. Subject with seroprotection at 14 days post first dose if the RVNA titer is more than 0.5 international unit per ml. And the secondary objectives, subject with seroprotection at 42 post first dose of test vaccine. Safety by monitoring subject with adverse events. Seroprotection, the protection obtained by vaccination. The phase 2 clinical trials designed total number of 225 persons considered of 5 study arms, 4 in rabies G protein vaccine and 1 in comparative vaccine, that is comparable group. Rabies G vaccine arm included 10 and 50 microgram and schedule on 03 and 037 days. A complete seroprotection, 100% protection was achieved for all dose schedule regimen at day 14 and sustained the same at day 42. So no side effects, adverse effect or anaphylactic reaction was reported in phase 2. Out of total 225 subjects, 40 subjects reported with mild headache and one of the most frequent adverse effects, followed by muscle pain and tiredness. Most frequent body symptoms affected by adverse effect was general disorders and administration site condition in 12% subject, musculoskeletal and connective tissue disorders in 9% of the subject, and nervous system disorders in 8% of the subject. So, objective to establish a non-inferiority of a novel 3-dose recombinant rabies G protein vaccine, that is Travis, to be administered as a simulated post-exposure prophylaxis when compared to 5-dose WHO pre-qualified vaccine for better safety and immunogenicity. So the multicentric open label assessor blind center specific block randomized parallel design phase 3 clinical study was conducted among 800 subjects. The eligible subjects were randomized in 2:1 ratio for recombinant rabies G protein vaccine and the reference vaccine. The subject in combinant rabies G protein vaccine arm received 3 doses of vaccine on 037, while subject in reference vaccine arm received 5 doses of WHO pre-qualified vaccine on day 037, 14 and 28 days. So the primary objective was to demonstrate non-inferiority of the test vaccine on day 14 after first dose relative to the reference vaccine in terms of seroprotection rate. The seroprotection rate, the titer was more than 0.5 international unit per ml. The rapid fluorescent focus inoculation test on 14th day was the primary endpoint. The secondary endpoint were the seroprotection rate on 42 post first dose of study vaccine and the frequency of solicited and unsolicited adverse effect reported between 0 and 180 days. Participants were also monitored for compliance throughout the study. About 9.9% subject in recombinant rabies G vaccine, that is Travis arm, and 17.2% subject in reference arm reported adverse event. That means the adverse effect or the adverse event in Travis was almost half from the other vaccines. The novel 3-dose recombinant G protein vaccine, that is Travis, was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. In vaccine doses leads to reduction in number of visits and travel cost, as well as increase the compliance, which is important to prevent rabies and ultimately help in enhancing dose-mediated human rabies by 2030. So, Travis wins the ET Pharma World Award for Innovation Pharma of the Year. Cadila Pharmaceuticals rabies vaccine Travis received award at Golden Globe Tigers Award in Malaysia. That is good. Thank you very much
for your time. Thank you.
Thank you so much, sir. And from the as well as I was request for the participants can drop their questions in the drop box, and we will read out all the questions to the queries. And we have received some questions also.
Previously, there was 5 dose regimen for the rabies vaccine.
And nowadays it is only 3
So
doses.
we have received some
doses
questions also
vaccine.
from doctor side. The Dr. Surikant sir asking about that if the person have completed all the 4 doses of PEP, then after 4 months he had dog bite with cat category 3, will we consider him as PEP or re-exposure? This is the
If the person has 4 months he had category 3, will be considered. Actually, category 3 is considered as a re-exposure.
Yes.
Category 3 as a re-exposure. So, in that situation, we have to do the full course of anti-rabies vaccination in category 3.
If any more questions, you can put your questions in the comment box. One more question, sir, from Dr. Soni, sir. Is 3 doses sufficient? Asking from Dr. Anil Balu, sir.
Yes, it is sufficient. 3 dose rabies is sufficient. But if the category is 3 in dog bite, you can add the immunoglobulins also along with the active immunization. In category 3, the passive immunization is also needed in category 3. Anti-rabies globulins.
So, sir, in comments, we are getting the minimum responses also for their
Thank you very much. Thank you for
sending us the very informative session is also there. Many of the participants said that good conversation and before closing the talk, I want to thank you so much, sir, especially Dr. Arvind Chauhan, sir, for the informative talk. We truly appreciate your efforts, sir. Last but not the least, we would like to inform you that SEBIS has prestigious awards in the innovative category, Indian Pharma Awards and Golden Globe Tiger Awards. Sir.
very good.
So it's a validation for humanity also that pride SEBIS the dosage regimen for dog bite victims or any animal bite victims for rabies cases, that is the 5-dose regimen, and which will having the schedule of 28 days, which is a very long schedule, and it's a pride of India. And India is having a fly high. हम देख रहे हैं सर डेली बेसिस पे लाखों झंडे गाड़े रहे हैं भारत, और अभी कोविड सिचुएशन में भी देखा कि भारत ने ही पहला वैक्सीन डेवलप किया था एंड पूरे विश्व में सभी लोगों को हेल्प की जहाँ पे भी जरूरत नहीं है. नाउ रिसेंट टेस्ट चल रही है, इज आल्सो बाय इंडिया. So it's a pride of India as a that is the rabies is also a pride of India because it's a world first 3-dose anti-rabies manufactured by Cadila Pharma itself only. So thank you all the participants. Thank you so much. And before closing the ceremony, we will to hand over the momento for a great presentation to Dr. Arvind Chauhan, sir.
Thank you.
Thank you, sir. Especially, thank you so much, sir. Thank you, sir. Thank you.
चलो अच्छा रहा, है ना, अपना काम बन गया। इसकी कनेक्टिविटी की कई बार छोटी मोटी समस्या होती है।
Yes. So I request technical team also, please close the session.
अभी तुम्हारे कैडिला वालों का फोन आया, इस पे कैल्सियम है ना, बोले सर नहीं बंद, अभी भी चालू, ये चालू होगा सर। अभी भी आ रहा है क्या? अच्छा, पार्टिसिपेंट अपन ये वाले